two, one, two.
Hello? It's okay? Today I'm ready for the field. Are we ready? Are we set? Good evening to all of you, and welcome once again to our daily press briefing, where we give you an update country level. So this has already been given all the time. The statement has always been given out to you, the media, by the Honorable Minister of Health, Honorable Hamid Lamin Samate, and today he could not be able to make it, and then Dr. Mustafa Bite is going to read his statement on his behalf. So on that note, I now invite Dr. Bite to come and give this statement on behalf of Honorable Hamid Lamin Samate. Dr. Bite.
So good evening, ladies and gentlemen. This is the 28th National Situation Report since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th of March 2020, when the country reported its first case of COVID-19. So 23 laboratory samples have been collected for processing. 4 additional people have been taken into quarantine. All 4 are Senegalese nationals who sneaked into the country. Currently, the country has 76 persons under quarantine and 6 active cases. Globally, since the 31st of December 2019 and as of 17 April 2020, a total of 2,248,037 cases of COVID-19 have been reported. Of these, 154,126 deaths were registered and 570,792 recovered from the disease. Senegal recorded 342 confirmed cases, 198 recoveries, and 3 deaths. Like I said earlier, we have 76 people on quarantine. A total of 316 tests were conducted and 9 were positive. 254 people completed quarantine, 241 contacts traced, and 310 people completed follow-ups. There have been daily coordination meetings ongoing at both the strategic and technical levels. Regarding our next steps, the Ministry of Health will embark on the following: deploy newly hired health personnel to their duty stations, follow up and provision of continuous psychosocial support to affected communities, persons under quarantine, and treatment, and those who have just been discharged from both quarantine and the treatment centers. Continue testing of all persons under quarantine before discharge. Strengthen community surveillance and risk communication and community engagement in all regions with undesignated border areas, especially in some villages in the URR which border with Senegal. Continue with daily follow-ups of low-risk contacts and those discharged from quarantine. Encourage public reporting and self-reporting of suspected cases through the toll-free line 1025. Provide security in the homes of all persons currently quarantined. Finalize and distribute treatment guidelines. Distribute donated motorbikes to field workers to facilitate contact tracing. Expand testing criteria to test more people. Continue more step-down trainings at regional and facility levels, and also to strengthen the rapid response team and contact tracing teams at all regions. On the rumors about condoms circulating, we would like to assure the general public that the national COVID-19 plan is comprehensive and does not include only materials that will be bought by government, but also those to be given by other partners. There is no actual procurement of condoms by the Ministry of Health. The procurement is based on the most urgent needs, and that does not include condoms at present. We will refer you to the specific press release on this subject and also invite you to review the official national COVID-19 plan, which is available to the general public. The state of public emergency regulations have been amended in response to the needs of the Gambian people. We would therefore appeal to market vendors, shopkeepers, restaurant and bar owners, salon and barber shops, private and commercial vehicle owners, as well as motorcyclists, to continue adhering to the regulations in their amended forms. We continue to encourage the general public to use the locally made face masks anytime they venture outside. Together, we can fight against COVID-19 in the Gambia. Thank you very much for your kind attention.
Thank you very much, Dr. Bitey. I now invite Sankano to facilitate the question and answer session. Mr. Sankano.
Thank you very much, Director of Health Promotion and Education, Mr. Modunjai.
I've said that before. I've been attending the press conferences here, so I want to just know what is the belief at the level of the ministry. And then the other one is the predictions that maybe around June, July, we may receive more cases, but that is in the future. As of now, what I want to know is what is the capacity? I mean, what number of cases can we handle as a country as we speak right now? I want to know about that too. And then the other one, if I am allowed to go ahead still. I can go ahead, yeah? Oh, okay, that's fine.
First question about belief, and the second question is about capacity.
Okay. So thank you very much for the questions. Um, us- so the cases we have, the actual number we have is that we are reporting. There is nothing hidden. We have been very transparent as to the numbers that are confirmed, the numbers that are tested. As to whether there are other patients who are positive and maybe are in the community, it's possible because we've seen that we've had a local transmission, but we are actively searching. Any case that we see that fits the definition, we have tried to contact you and test you. And so far, even those who were confirmed cases, their immediate contacts were all tested and were not found to be positive. Their contacts of contacts have been tested. So the people that are coming into the country that we suspect are coming from hot areas, we've captured them, put them, we've taken them, not captured, but we've taken them to quarantine, and many, they've not shown symptoms, many of them have been tested. So we are doing what should be done by the book to ensure that we don't have any other case in the community. But you have people sneaking in. We don't know whether all of them have been taken to quarantine. So this announcement by the minister, it doesn't mean that we just believe that there is a lot of cases in the community. What we think is that just like we've been proactive, for example, countries were not testing those who were in quarantine. We decided to be proactive. We tested and we found it's yielding results. So we are not resting on our laurels. This testing is also another proactive measure that the government is taking to say, look, we are doing everything we have. We are not having any cases. Maybe we are fine, but let's be more proactive. Let's test more people. Let's test anybody with symptoms, even though you don't have, you don't have any link to any contact case, even though you've not come from any country. So this is just to be more proactive that the ministry is doing so that we test more. But it's not that we strongly believe that there are people outside, but it's a possibility that you can have one or two outside who come into the country or who were in contact with someone that you missed, and it's a possibility, but we don't think there is a very strong likelihood. But this is just a proactive measure that the ministry is taking to ensure that we don't leave any stone unturned. It's just one of the measures we are taking. So the capacity regarding right now at the treatment center, we have 42 beds available, and we have another potential 8 beds that could be there. So if the 42 beds were full, we could have 50 beds. So the treatment center is far from being filled up. We have another treatment center in MRC, which is far. So capacity-wise, we can deal with many more cases as of now. And even that, we've not stopped. We are doing more treatment centers. Right now, there are a lot of things going on. There are works going on other treatment centers. Like, for example, one that is earmarked in Sukuta, work is going on there, and there are other ones that work are going on. So this is just envisaged for the future if we are having more cases. So preparation-wise, we are always trying to be ahead of the disease. We don't wait until we need it, then we start working on it. So capacity-wise, I think we should be fine with that. Thank you.
Final question? On? Research, yeah.
And then following the other countries in sub-Saharan Africa here, they'll always refer to WHO guidelines and regulations. So my question would be whether at national level we have labs and scientists, that can collect data, analyze the data, that would depict what is happening in the countries, and then pass that independently of WHO, whether that is possible. I want to know, because most of the times when I follow the press briefing in most of the countries, they'll always make reference to WHO, even though they're talking about their own countries, and I've also observed that here. So I want to know whether we can do our own research and collect data which is independent of WHO. And then the other one, recently I have seen so many apps on the Play Store about temperature and how you can measure what the temperature of your body is and whatsoever. So these apps are there, but I don't know how authentic those apps are, and whether the ministry is also monitoring that to know, because some people are using it. I have seen, because it was recommended to me, and I downloaded one. I have it in my phone there, but I haven't heard the ministry talking about it. So I want to know how authentic those apps are, and whether we can rely on those apps And about the testing also, when the minister said you can come out and test naturally, I don't think Gambians would voluntarily come out to just test where a virus is mentioned. So in Lagos, they were doing house to house. So I don't know, for the safety of the general public, whether the ministry is also considering taking those steps. Yeah, thank you.
I think those are 3 final questions. Dr. Jonas, thank you.
So thank you very much. Very good questions regarding research. We have in our thematic areas an area that we also look at research, psychosocial support and research. And like you said, most countries would like to rely on their own data to have inferences, to make decisions that affects their own country. Yes, in the Gambia, we are looking at that. There are some studies that are being discussed, and they are at the concept note level. And even the data that we are using, for example, for the projections, is emanated from the Gambia. Some statisticians who are in the Gambia looked at it and gave us that. And then you have conflicting ones from the same Gambia, which is giving higher ones, like thinking of between 70 to 93% of the population could be infected if social distancing and all those measures are not taken. But you know, all this data is coming. But I can tell you that in our advisory group, the people in that group are Gambians. They are highly renowned. They are only in this country most of the time because of the corona's restrictions, but normally they would have been consultants for WHO or other big funders. And we are capitalizing on their experience and the others. So we discuss these issues with them, and you know, they offer advice. So in coming out with the data, usually you do analysis. So you can have the data around, if you don't have your own studies, for example, which we are developing, and most of them, I know of 2 which are at the concept note level, and I've reviewed them and all. So one of them looking at knowledge and perceptions of the general public on COVID and the interventions being made. The other one is a possible clinical trial, looking at the drugs and see which one would best suited for Gambians and all, so that we can have our data. But yes, the best thing is to rely on national data. But this disease is going fast, and most of this research is, you know, if you want to wait for your own national data, to use the funding to put there, gather people, ask questions or test them, and then before you come out with the inference, it will take time. And sometimes only one study is not enough to inform a decision. So you do a meta-analysis or a review of different studies, then come out with something. Because one study could be it may just be a goof. And if you rely on that alone, might be a problem. So what we are doing is we look at all the studies going around in the world, and then it advises our policies and what we do next. So you can see that even WHO did not. And sometimes, you know, you look at all the data and it's not very convincing. You discuss among yourself, you use anecdotal data, and then make sure that you do something that you think would be best for the country, and you try it and it works, and you know that this is the best. But I'm trying to tell you that we have experts who look at all this data that are available, not only national data. What would be best is to use national data, but sometimes you cannot wait for that to make big decisions like this, because the disease is going very fast. But there are in situations where research is being considered for these things. But as of now, we're using general data and analyze it in our own context and see what we think will work. And there are some studies that have been done, for example, not big studies, but assessments. You know, like recently, our logistics department have gone around to do assessment, to look at what the gaps are, and then analyze it based on what is available in other countries, then advise us, bring in recommendations. The case management team have done 2 assessments. They've gone around the country, do assessment, look at it, so that we have objective things that we use to decide on where we will put the treatment centers, what mechanism will work, and all that. Yes, those are not big studies, but we are doing them at a small scale also. So for the recommendations, this will be very difficult for me because I don't know about these apps. But if what we want is you regularly take your temperature, and it doesn't have to be very objective. To just know, if you anyhow believe that your temperature is high, then you know it will be good to call and see whether we can do the testing and all. But it doesn't have to be very accurate like the ones we have. This is just at the community level. So my advice is, even if you don't have the thermometer and you start to feel that you have this cough or this fever, it doesn't have to be very accurate like the ones we have in the hospital. This is at that level, it's just a screening level. So so that when you come, we might tell you truly it is high or truly it's not high. Then it's okay, but you would have come and then maybe you would have done the necessary steps. So, but I cannot say, I don't know about it, so I cannot recommend or disapprove it. Yeah. So the house to house, I think is a good suggestion, but as you know, even this testing we are doing is just being proactive. And I think if we see that it's not yielding the results, people are still reluctant, because the risk communication is doing a good job. So, for example, if we go to communities and we've noticed that they are not complying, when we send them in and they give their information, most of the times they start coming. Or the psychosocial group, we send them there. So if this information is going and they've done work and people are still not coming, then we can decide on probably using another method which will best suit the Gambia. Thank you.
Thank you very much, Dr. Mustafa Bike, for that elaborate response. And on that note, Director of Health Promotion and Education, have anything to add?
I think basically Dr. Vite have really answered the questions according to how they have been asked. And thank you, Modu, for those brilliant questions. And as he also rightly mentioned, as WHO is the technical specialized agency for health within the UN, automatically most of our documents, guidelines, and protocols definitely pass through them, because they approve those documents for countries. So therefore, we don't want to work alone as a country, but at least most of our documents, which has to do with health, they have to pass through WHO for vetting and approval. So this is how we work, and I think they are also not deciding for us, but we work in collaboration. So anything we do, we work together with them. So I think this is something that has been answered by him. So thank you, Dr. Bide, for those responses. This is, and also when we talk about capacity, I think we are really strengthening our efforts. The isolation centers have been identified, and also, most of them are operational. Some areas also need refurbishment, some also need adjustment. Also looking at the treatment centers. One is in the Combos here, here, Banjul, and the other one has been prepared in Sukuta. And also an assessment have been done for that of Mansa Konko, and arrangements have also been done for URR, where at least when land is available, at least some of those things. There are a lot of things that are ongoing. So, and so as we move on, we are also planning. And then I think we'll also, this update, these sessions are always very good, because we also give an update as to where we are. But I think, as he rightly mentioned, we are really moving forward, and I think we're also trying to expand our human resource capacity. As you know, that most of now the ministry is also recruiting more and more people, so that they can also be joining the other forces that are currently on the ground. So I think something is happening. Thank you.
Thank you very much, Director of Health Promotion and Education, Mr. Modunjai, for that important summary on international standard and best practices that we adapt to our Gambian peculiarities. On that note, I would like to end today's session. Thank you very much on behalf of the Risk Communication Committee and also National Health Emergency Committee, and on behalf of everyone, thank you all for joining us. See you on Monday. We are not coming tomorrow unless we have a new case. We pray that we don't have a case. Thank you very much.